Hello, good morning and welcome to the AM News. We're also on Joy News on DSTV channel 41 and GoTV channel 144. I am Peter CBD. In our first story, the majority in Parliament has overturned the decision to reject the 2022 budget without minority in the chamber. Majority Leader Osei Chairman Sabonsu said the rejection of the budget did not meet the test established under Article 104 because Parliament did not have the required numbers. The First Deputy Speaker, Joseph Osei counted himself as an MP, making the majority caucus in the House 138 members. He explained that this paves the way for Parliament to carry out the rescission motion moved by the majority. In a one-sided House, the majority overturned last Friday's rejection of the 2022 budget.
The results. Those in favor of the request, that's the prayer of the Minister of Finance for more time to do consultation with the leadership.
Honourable members, the number presented to me by the clerks at table is 137 of you plus me, MP for Bekwai, 138. Honourable members, for the avoidance of doubt, let me read out the constitutional requirement so that there's no confusion as to who can vote, what numbers are required to take a decision. Article 104(1). Except as otherwise provided in this Constitution, matters in Parliament shall be determined by the votes of the majority of members present and voting. The vote of the majority of members present and voting, with at least half of all the members of Parliament present. What it means is that before you take a decision, there must be at least a majority of all members present. With me, we have 138 members. That's a majority. It doesn't mean that all the 138 must vote yes or no. A majority of this 138, their decision will carry the day. So I'll go ahead and put the question on the motion proposed before us. All in favor of the motion, say aye. All against, say no. The ayes have it. The motion is carried.
Meanwhile, despite the minority in Parliament's push to have the 1.75% electronic levy on mobile money and bank transactions withdrawn, Chairman of Parliament's Health Committee, Dr. Nanayao Afriye-Ayu, says it will be key in funding healthcare in Ghana. Speaking at the 2021 Digital Health Week celebration organized by Farm Access Foundation, he suggested that the levy can be put into a fund to partly fund healthcare. Kweko has more in this report.
One of the key issues that led to the rejection of the 2022 budget by Parliament was government's plan to levy electronic transactions, mobile money and other bank transactions at a fee of 1.75%. It is currently a subject of negotiation between the two sides in Parliament on the way forward. But as the negotiation progresses, Chairman of Parliament Health Committee, Dr. Nanayao Afriye-Ayu, says the levy will be key in funding healthcare in the country. He was speaking at the Digital Week celebration organized by Farm Access.
And this is where I think that we need to support government to get the e-levy through. I'm moving into the age. And this is going to rake in about, let's say, 5 or 6 billion cedis a year as captured in the budget. Point is that there's a thin line between health and finance, economy. If the economy is not doing well, it affects the health sector, and vice versa. Even on quality of health, we would need more resources. And because we will need more resources to be applied in the area of digital healthcare, so do I also agree that there must be digital taxation.
At the center of the week's celebration is digital health and how it can improve healthcare outcomes. In an interview with Joy News, CEO of the National Health Insurance Authority, Dr. Lydia Jan Selby, argued that it's very crucial to digitize healthcare to improve access.
Once we link everybody, then we can plan some other kind of services around prevention. We now want to think about preventing illness rather than waiting for you to be sick so we treat. So we are encouraging everybody, use the *929, link with your Ghana card, and then we, together with Ghana Health Service and the ministry, we will give you preventive health services as well.
Country Director of Farm Access Foundation, organizers of the week celebration, Dr. Maxwell Entry says that digitization of healthcare access will significantly improve the country's healthcare system.
It's one of the inefficiencies at the patient delivery level, where we can use technology to make patient delivery, healthcare delivery service efficient. You know, if someone is a diabetic or has diabetes and collapses in the middle of Central Business District of Accra now and is rushed to a hospital and the folder is stuck in a warehouse full of old folders, by the time the health staff are able to retrieve the folder and flip through to know that patient A actually has diabetes, we have something in medicine called the golden 1 hour. That golden 1 hour would have been lost and would have serious and adverse sequelae on treatments.
On his part, Executive Director of the Christian Health Association of Ghana, Dr. Peter Yeboah, expressed the readiness of his organization to partner the state and other relevant stakeholders to deepen digitalization in the health sector.
As CHAG, we are looking at how we can use digital solutions to improve supply chain processes so that, one, the three key elements of attaining universal health coverage, which is one, access, is improved to ensure that all people living in Ghana have access to services that are required. And the second aspect is quality. You observe that through digitalization, we have mechanisms for authenticating medicines. One of the key challenges with the entire system has to do with substandard, spurious, counterfeit, or low standard medicine.
Away from budget-related issues, Chairman of the Christian Council of Ghana, Reverend Joseph Obiri-Aboamante, says some aspects of the punishment in the Proper Sexual Human Rights and Ghanaian Family Value Bill are too harsh. He's proposing a reduction in the punishment from 5 years to at least 2 years. He wants proponents of this bill to revise this. He's been speaking to Joy News on the sidelines of the Capacity Building on Leadership, Diaconia and Development Summit for Selected Churches in Africa.
Bill is that sometimes the offenses that they said if you commit the offense, the penalty, some of the penalties are too high, and I would wish that Parliament would bring them down. That's my only comment. Where it is 5 years, it can be 2 years. Where it is 10 years, it can be 5 years. Things like that. Otherwise, but then beyond that, if you read the bill very carefully, I think it's very, very healthy, and it really speaks the mind of most Ghanaians, about 90% of us. Of course, you will have some 1% that will talk. They could be intellectuals, they could be lawyers and so on. But please, we are not just dealing with interpretation of law. We are dealing with the philosophy behind the law itself. We are dealing with what they call jurisprudence. And I think they should come back. People should come back. They are touching the souls of Ghana, and they should accept this bill. They can amend a few things here and there that are peripheral. But the main content of this bill, we Christian Council and all the churches in Ghana have written to support this.
Moving on, it is estimated that a majority of people who need mental health care in Ghana cannot access treatments. This has largely been attributed to the lack of attention by government to the sector. Currently, Ghana spends just 1.4% of total government health expenditure on mental health. The Mental Health Authority, in a bid to halt this, launched a mental health policy earlier this year and has followed up with a workshop to train healthcare providers up north. Correspondent Martina Bugri reports.
Workshop brought together stakeholders from government agencies within the Northern Belt. It was to disseminate the findings to this group. Speaking at the forum, Chief Executive Officer of the Mental Health Authority of Ghana, Professor Akwesi Osei, said the state of mental health delivery in the country has seen some improvement.
The mental health situation, I would say, is improving. It's not going to the point where we want, but we are happy. If you look at where we have come from and where we are now, what I mean is that some time back there were only 4 psychiatrists in the whole country. Now there are 51, and we still have about over 50 in residency. All this will come to that in the next 2 or 3 years. And the numbers are increasing. Psychiatrists, we are having more clinical psychologists, a lot more are coming. We are having mental health services spreading nationwide. In the past, if you talk about mental health care, it was Accra, Akafo, Pantan. Now, thank God, the government is going to build 2 new psychiatric hospitals in the middle and northern belts. So on the whole, talk about availability of medicines. In the past, some 7 good years, we didn't have medicines. Now every year we have some quantity, not good enough, not adequate, but at least some quantities. And all this shows that we are getting there. Families are now appreciating and they are coming for their patients more than in the past.
He added that mental health care requires more than just the doctor, but all inclusive to offer support.
What we mean is that you require a whole lot of people to bring anybody on board. Indeed, a person having mental illness is not his problem alone, the whole family and the whole society. Likewise, to bring care to the person with mental illness, it requires more than just the doctor. After the doctor and the nurse, they have seen the patient for improvement, you need somebody to give them back their skills. That's the occupational therapy. You need somebody to be talking to them, counseling, clinical psychologists. You need social welfare to be able to see whether the family or home background is suitable or not. Social welfare. So you need a whole lot of things. Plus active players like the town development, youth organizations. You need a whole lot of people to come on board.
Some participants shared their thoughts on the subject. Edward Owusu, a participant, thinks it will go a long way to help improve mental health, but tax funding as a major challenge facing the mental health institution.
I think that funding is one of the major issues that we are facing in our various mental health institutions. When we come to the communities, we need just some few resources to do our work, but sometimes as a result of funding, we are not able to get them. So my major issue has to do with funding. If there will be any way that the state can help mental health authority, at least giving a certain percentage out of the various money that we generate in other sectors, it will go a long way to improve mental health care in our country.
The United Nations Capital Development Fund, through its Boosting Green Employment and Enterprise Opportunities in Ghana project, is constructing climate-resilient culverts at Yebu in the Ahanta West municipality of the Western region. The project is expected to serve and relieve the community members from the unbearable situations during the rain. Correspondent Inathalia Kwanzaa has more in this report.
This is a typical concrete making site. Ideally, it should have been dominated by men, but the reverse is seen here. Over 30 women given the opportunity under the United Nations Capital Development Fund through its Boosting Green Employment and Enterprise Opportunities in Ghana project to construct these culverts here at Yabil in the Western region.
This project, and I'm mom here to man.
Green Project is responsible for the construction of this bridge. I have never seen women fixing culverts, but here in the Ahanta West, women equally are able to fix the culverts because the men are inadequate. The number of the men are 18, while we are 30. We support the men in fixing the culverts. We are grateful to Green Project, and accounts have been opened in which our monies are deposited for us to go and collect. This road has been deplorable for about 23 years. Now that it is being fixed, if anyone would want to come to Kijebu, it would be much easier.
The construction of the climate resilient proof culverts bridge has become necessary considering the deplorable nature of the road between the Yabil and Kijibri communities. The Ahanta West Municipal Works engineer Frank Japon, speaking to Joy News, says members of the two communities were not able to access nearby facilities such as schools and healthcare centers, among others, whenever it's rained.
And the Kijibri side is going towards the where the culvert is constructed, so that, as you said, especially the pregnant women, the children, and the other people too, they can have easily access to the health facility. The chief's compound is just about some few meters away from the culvert, and the Kijibri chief's compound is also very far from here. So we constructed this culvert specifically to link between the two communities so that they can have access to the chief compound.
The Boosting Green Employment and Enterprise Opportunities in Ghana project is a 4-year action plan from the European Union, the Embassy of the United Kingdom of Netherlands in Ghana, SNV Netherlands Development Organization, and the United Nations Capital Development Fund. The project aims at creating greater economic and employment opportunities for youth, women, and returning migrants by promoting and supporting sustainable green business in the Ashanti and Western regions. Technical specialist for the local Government Finance, UNDP, Angela Yaira Kwashi says, with the recent climate changes across the globe, climate resilient infrastructures should be implemented to support the rural communities for sustainable economic development.
Because we are trying to build resilient infrastructure, climate resilient infrastructure, the MMDA, in consultation with the community, they have selected this project because when it rains, the whole area gets flooded, which prevents the community members from moving up and down this road. And also, when we were coming, you saw a chips compound. So it prevents them from accessing this facility. Now, this infrastructure project is going to make sure that even in times of heavy rains with flooding, the community members can still, traverse this corridor and to access other opportunities on the other side of the road.
Some beneficiaries who were present lamented on the deplorable structure of the bridge over the years, depriving them access to other neighboring communities during the rain.
Weeks ago, we were informed that the Green Company want to start a construction project on the road from Yabil to KJB. The road was previously a walkway, but our chief, Nana Dakunama the 10th, worked for it to become accessible to cars. Unfortunately, we did not have the expertise and resources to install the culverts and other rings needed to continue the construction, so we gave Green Project the go-ahead when they proposed the construction project. This area used to be very deep and dangerous, so we were glad when the project was approved.
The bridge has disturbed us a lot. When it rained here, we could not go anywhere because the place was flooded, and we would have to wait until the rain stopped before going anywhere. We are very happy that Green is fixing the bridge for us, and I pray that they continue the good work and fix it completely. When the bridge got spoiled, we told the chiefs, but they did not do anything about it. We are very glad that Green is fixing the bridge for us.
Beneficiaries of the Green Project were allocated new accounts through which their allowances are paid while benefiting from innovative financial services. Green is implemented under the European Union Emergency Trust Fund for Africa with the financing of 20 million euros from the EU and co-funding from SNV and UNCDF. For Joy News, in Athalia Kwanza, Western Region.
And that's how we end the AM News. For more news, you can log on to myjoyonline.com. My name is Mapito Sibidi.